Hey everybody, Dan here with EasyPostureBrands.com. In today's video series, we're going to be talking about the best stretches for individuals who sit for a prolonged period of time and experience back pain with this. We all know that back pain is associated with prolonged sitting and that there's many different types of lower back pain that can be irritated with individuals who sit for a prolonged period of time. So whether you're somebody who's dealing with discogenic lower back pain or myofascial lower back pain, whether meaning if you're somebody who has pain coming from the lumbar disc or pain coming from more the muscles and connective tissue, prolonged sitting can be irritating with for these kind of pathologies. The reason why that might be is because when we're sitting for a prolonged period of time, our connective tissue at our lower back is kind of in a slight flexed or stretched position. And so over time, that's going to cause some irritation. Additionally, our hip flexor muscle group is in a shortened position. So over time, over hours and hours of sitting, that can be very compressive on our lower back if our hip flexors are constantly pulling us down and compressing our spine. Additionally, one big thing that I tend to see a lot in the clinic is as we're sitting and typing away at a computer or holding onto a steering wheel, our mid-back can stiffen. The reality is we have to pick that motion up somewhere. Oftentimes that's going to be at our lumbar spine. And so individuals who have very stiff mid-backs are going to experience higher amounts of lower back pain. Fortunately, there's a lot of different things that we can do to help improve back pain associated with prolonged sitting. Often our interventions are going to be focused around adding extension to our lumbar spine, adding rotational mobility to our mid-back or our thoracic spine, and then adding some extension into our hips. We're going to both add some mobility work here and some strengthening so that we can be resilient into these positions. So if you feel like your lower back pain is coming from prolonged sitting, follow along our exercises, and we'll kind of get you started on this rehab journey to reduce the back pain associated with prolonged sitting. This exercise is called the half kneeling hip flexor stretch. If you know anything about the hip flexors, you know that hip flexor tightness is associated with lower back pain. The reason for that is our psoas muscle. So psoas muscle is a hip flexor muscle, goes from our lumbar spine, our lower back, onto our femur. If this muscle is very tight, it can compress our lower back, which can lead to lower back pain. So this exercise is meant to improve the extensibility or improve the mobility of that psoas muscle, including our entire hip flexor muscle group. You're going to set up on one knee, and what you're going to do, keeping your core tight. So I'm not going to be extending at my lumbar spine here. I'm keeping my core tight. I'm going to shift my weight forward, extending at this hip. My shoulders are just a touch in front of my pelvis here as I shift forward until I feel a little bit of a stretch here. Once you find that stretch, I'm going to squeeze this glute. So I'm engaging this muscle as if I'm kind of pinching the back pocket muscles together here. So I'm squeezing and engaging here, and you should feel a really nice stretch kind of on the front of this hip. You're going to hold that position for somewhere around a 20 count. So I'm engaging this glute and I'm holding that squeeze for a 20 count. If you need to hold on to like a broomstick or onto a wall in order to not feel like very wobbly with that, that's okay. The goal here is to improve mobility, not necessarily to work on that kind of bounce or up in this position. Holding for about that 20-second count and then switching to the other side. So down on one knee, bringing the front knee up. Again, I'm keeping that core tight. I'm not extending here, but I'm shifting my whole kind of torso forward. Those shoulders stay slightly in front of that pelvis. Squeeze, engage that back pocket muscle. You can do a slight posterior pelvic tilt or a slight hip tuck if you feel like you need to get it deeper. Hold for about a 20 count, holding for 20 straight seconds. And relaxing. I would go for about 2 to 3 rounds here each side, making sure that you're really squeezing those glutes as you're holding that end range. And if you need to add a little hip tuck to get a little bit deeper into that stretch, certainly able to do that. This is called the half kneeling hip flexor stretch. This exercise is called the open book stretch. This is a great stretch for people who sit for most of the day because it's going to open up our mid-back or our thoracic spine. We might also get a little bit of a stretch in the hips and a little stretch in the lower back as well. You're going to take your bottom hands when you're laying on your side, so whichever hand is on bottom, lay it right on top of the knees. Top hand is going to reach as far forward as you're able to, so I'm not just kind of throwing the shoulder, but I'm reaching and rotating my spine. And then slowly, as if you're opening a book, rotate towards the other side. My eyes are going to kind of rotate with that hand. Pause for a couple seconds, 2 or 3 seconds, and then rotate back. Rotating open. If it feels nice, you can hold it for even longer than 2 or 3 seconds. Typically what I do is I hold this for about 2 to 3 seconds, and I get more repetitions out of this. So I usually go for about 8 to 10 repetitions. If it feels nice, if it feels right for you, you can reduce the amount of repetitions and hold for longer time, maybe a 5-10 count. I'm not usually holding this end range rotational position for longer than 10 seconds, whatever kind of feels best for you within that kind of 10-second time frame. So typically I'll do 2 to 3 second hold, 8 to 10 repetitions. If it feels right for you to do 5 by 5, 5 repetitions by a 5-second hold, that's an appropriate dosage as well. This is called the open book stretch. Just so you can kind of get a visual, I'll show you a couple repetitions here on the other side. So again, I'm laying on my side with my hips kind of bent up close to about 90 degrees. Bottom hand lays on top of my knees, and then that top hand is rotating open, as wide open as you can go. My eyes are staying on that hand. I'm feeling a nice stretch all through my bin back, even into my lower back and into that hip. Holding for 2 or 3 seconds, and then reach and rotate back. Rotate open, hold for a couple seconds, and then reach and rotate back. An appropriate dosage here would be about 2 to 3 sets, somewhere around 8 to 10 repetitions, holding for a 2 to 3 second count. This exercise is called the prone press up. This is a great exercise for individuals who sit all day because we're going to be getting your back extending and moving the other direction. So whether you're kind of driving in a car all day or sitting at an office desk all day, the purpose of this exercise is to just get our back moving the other way. It should feel good. If you're familiar with the McKenzie method or watched our McKenzie method interventions, you're already familiar with this exercise, but it's a great exercise to kind of reiterate here. So what you're going to do is you're going to lay flat on your stomach, so laying all the way prone, and then you're going to put your hands as if you're about to do a push-up. From here, you're going to slowly push your chest up, kind of using all arms. So I'm making sure my lower back and my abs aren't like overly contracted or guarded. I'm going to pause for a breath and then come back down. I tell my patients in the clinic to picture that you're kind of leaving your belt buckle on the floor, making sure you're not lifting up at the hips, but belt buckle stays down. Wherever your range of motion is appropriate for you. So this might not be as far as you're able to move. Maybe you can only go about half that. Whatever feels good for you. So this exercise shouldn't be painful. It should feel good. We're gonna go for about 10, so there's 3. We're gonna do about 7 more here. Holding for that deep breath. Again, listen to any pain barriers that we have. Not trying to blow past any pain barriers. Wherever you feel that kind of pinching in your back, or you feel like you're kind of out of room, stop there. So sometimes you might only be able to get to here. Those elbows might not extend all the way, and that's okay. If you feel like you really need to kind of get into that full elbow extension in order for this to be comfortable, take your hands forward a little bit. You can still get fully extended at the elbows, but your chest won't be as high. If you feel like you've got more room to go, bring your hands back further underneath you, and now you can really extend by getting those elbows all the way straight. So for me, I feel best when I have my hands kind of right at shoulder height. I'm gonna go for about 4 more here. Pause for that breath. This is kind of the cadence I want you to go at. And back down. I'm gonna get about 3 more. Again, this is called the prone press up. A great exercise for individuals who sit for a prolonged period of time and have lower back pain associated with that. Get 1 more of these guys here. I would sprinkle these in throughout your day, trying to go for about 3 to 5 sets in a working day if you're able to. Some is always better than none here, but going for at least about 10 of those guys in a row, sprinkled in kind of throughout your day. Prone press up. This exercise is called a prone quad and hip flexor stretch. If you have a yoga strap, that usually works best for this exercise. If not, that's okay. A lot of times like a bed sheet works very well for this, or a long belt can work really well as well. If you have a resistance band at home, if you have a pretty strong one, you can also make that work for this exercise. What you're gonna do is you're gonna lay on your stomach, grabbing your strap, and you're going to slowly pull your heel in the direction of your butt. Once you get towards your end range, if that's plenty of a stretch for you, you can stop there. If you need to, you can even lift that leg slightly to get really deep into that hip flexor muscle group and just kind of choke up on that band to kind of get the maximum amount of stretch here. You're gonna hold this for somewhere between 20 and 30 seconds. My hip flexors are pretty tight, so what's appropriate for me is probably right about here. But if you have a little extra range, you can even add some back extension into this so I can kind of sit up a little higher in my elbows. And the goal here is we're just trying to stretch out everything along that kind of anterior chain that gets really tight with prolonged sitting. So we're trying to loosen up everything in that anterior chain and take some pressure off that connective tissue that's just been put on slack kind of all day. So here, I'm kind of compressing that posterior side connective tissue that's on slack all day with prolonged sitting, and I'm stretching out that anterior connective tissue that is kind of very tight with prolonged sitting. Holding for a 20 to 30 second count. I'm just gonna kind of take some time off. I'm gonna take a couple seconds off of it and just allow that connective tissue to relax so I don't get any kind of reactive spasm if I overstretch or hold too long. And I'll just kind of slowly choke up and work my way to my end range stretch. So I usually feel best right about here, but if you have a little extra range, you can add that kind of lumbar extension, kind of pushing through the elbow, or you can add that slight hip lift to get really deep into that hip flexor. Again, holding for about 20 to 30 seconds here. This is the prone quad stretch / hip flexor stretch with a strap.